want to kick things off by asking everyone to consider two scenarios. So the first is a situation where we have a person living with a health condition, and let's say that that health condition causes them ongoing knee pain. And the goal is to expose that patient to a treatment. And I use the word expose because I'm purposely not saying giving the patient a treatment, but we want to expose them to a treatment that's going to improve that pain. And so there's the treatment, and then there's actually the behavior of the person that's receiving or being involved in that treatment, for lack of a better word, that behavior that delivers or results in them actually receiving the treatment. So for example, let's say the treatment is an oral medication, a pill, and the behavior associated with delivering that medication is basically the person putting the pill in their mouth, swallowing it, and then repeating that on a regular basis. And for that to happen, the person needs to have a means to be prescribed the drug. They need to be able to acquire the drug. They need to be able to pay for the drug. They have to remember to take it. They have to have the motivation to take it. They have to have the time to take it. They have to be able to open the container that the drug comes in. They have to physically be able to put it in their mouth and swallow, and then to repeat that on a regular basis. And I'm sure there's a whole other steps involved in that behavior as well that I'm not missing, but I think you get my point. And you can imagine that time constraints, someone's gender, their socioeconomic status, where they live, their beliefs about medications and any side effects of those medications, again, just to name a few, is going to influence how successful they are in achieving that behavior. Regardless, taking a pill is a pretty straightforward thing, a pretty straightforward behavior. And as a society, we've used this approach numerous times to deliver effective treatments. And we're all familiar with that. But what I would say, and I know I can only speak for myself, I'm sure that we can all think of a time when we've been prescribed a medication and we've missed a day for whatever reason. So it's not always perfect. So let's talk about a second scenario. I want you to consider this time somebody who has a health condition, and let's say not only does it associated with knee pain, but there's also disability that results in inactivity, which may contribute to obesity and the development of comorbidities. The treatment is some form of exercise this time, or physical activity. And the behavior associated with getting an adequate dose of that treatment, of that exercise, comes down to the person exerting themselves physically on a regular basis. Again, for that to happen, the person needs to have the means to be able to get themselves to a space that's conducive to exercise, or to create it at home. They have to have the equipment they need to help deliver that adequate dose, have knowledge or access to somebody that has knowledge to lead the exercise. They have to be able to change their clothes. They have to have the motivation to exercise, the time to exercise, the ability to do the exercises, confidence to do the exercises, and then the ability to repeat that on a regular basis. And again, your gender, socioeconomic status, where you live, your beliefs about exercise, past experiences you've had with exercise, any side effects of exercise are also going to influence how successful they are in that behavior. So there's really two take-home messages from those two scenarios that I want us to kind of keep in mind as the speakers share their presentations with us today. The first is that there's an intervention, and then there's the behavior that surrounds that intervention that the person receiving the treatment has to do to actually receive the benefit of that intervention. And both the intervention and that behavior need to be considered in the design, the delivery, the evaluation, and the implementation of exercise-based interventions. And as we sort of highlighted, exercise-based interventions are sort of unique, and in many ways they're quite complicated, particularly when it comes to understanding and facilitating the behavior that surrounds them.